Okay, thank you very much, Captain Capello. This was great, thank you. Now we would like to move to the next speaker, which is Gordon Wu, who is with Risk Management Solutions, RMS, a catastrophist. The first question, Gordon, is that in the article, which is in your folders, you described the Ebola virus as both a serial killer and a loan shark. So please, can you elaborate on these concepts and how they should influence the workshop on the risk management aspects?
Thank you, Olga. Ever since the Black Death, pandemic disease has been portrayed as the Grim Reaper. But there are many ways in which the Grim Reaper can take his victims to an early grave. But the pandemic is more than just a vital source of premature death. If action isn't taken promptly to deal with this source of illness and death, then the price of dealing with it in future goes up and up. I think you're all familiar with the kind of situation with loan sharks, in fact, on both sides of the Atlantic. If you borrow $100 and you can't pay it back within a few weeks or a month, then the amount you have to pay back increases. So $100 can lead to a debt of hundreds of dollars to thousands of dollars, even tens of thousands of dollars that essentially can bankrupt you for life. And those figures, going from $100 debt to literally tens of thousands of dollars, that growth in debt is not dissimilar from what we're seeing with, like with Ebola or other types of major infectious disease. This escalation in what it costs to deal with the problem just grows as if we're dealing with a loan shark. Now, as was said previously, both Britain and America have historic ties with West Africa, America with Liberia, and Britain with Sierra Leone. And correspondingly, both countries were reasonably generous in terms of how much money they contributed towards fighting the war against Ebola. Now, this cannot be said of a number of other countries. So what we saw this time last year was both President Obama and Prime Minister David Cameron pleading with other countries to contribute more to the war against Ebola. So Prime Minister David Cameron in particular asked the European Union to double its contribution to the fight against Ebola. Now, given the fact that the doubling time for the number of cases of Ebola was of the order of a couple of weeks, a delay in getting the funds to help fight the war, a delay of a few weeks or a month, was just far too long. I think, as President Kim has said, this wasn't the right time to pass around the hat. Now, in Britain, there's a payday lender called Wonga, which is notorious for extorting money from those who have to resort to borrowing money from it. If you borrow £100 from Wonga, you have to pay back about £130 or even £140 within a month. That's how much you're extorted. Now, given the fact that the doubling time of the number of cases of Ebola was of the order of a couple of weeks, it would have been worthwhile for Prime Minister Cameron to call out Wonga and borrow the money from them to raise the money to deal with the crisis, rather than waiting for recalcitrant international partners to dip into their treasury for it. This whole problem of asking the question, who should be responsible for common problems, is one which is a well-known issue in many economic areas. It's not dissimilar from the tragedy of the commons, okay, where you have a common resource or common problem, and you can always look over your shoulder to someone else to like pick up the litter on the street. I don't know how many of you are in this kind of situation where you're just fed up with always being the one person who picks up the litter on your street. Okay, and it was not that similar last year, where certain countries were contributing a lot of money towards the fight against Ebola, and other countries were notoriously slow in terms of contributing. So this is a problem which was highlighted by the Ebola crisis of last year, and it's really a problem which the world community needs to address with regard to a future outbreak. And hopefully, part of the objective of this workshop will be to lay down some kind of ground rules by which this can take place.
Yeah. It's clear that we shouldn't have to go to loan sharks to finance responses next time. I mean, the governments have to do better, and we all have to do much better in having the sufficient funds, in contingencies in time. Now, the next question is about the risk profile of epidemics, something that you have studied very closely. And how does it differ from other disasters that require a public response?
Thank you for that, Olga. My office in London is right by the monument in London, not like the Washington Monument here. There's another monument in London, which is a monument to the Great Fire of London in 1666. The Great Fire of London burnt for 5 days, and about 80% of the population became homeless as a result of it. At that time, there's no fire service, there's no organised way of putting out the fire. But the monument is not just a monument to the Great Fire of London, it's also a monument to the insurance industry. Because the following year, the very first insurance came into being because of the perceived need to be able to compensate people who lost out in a tragedy like that. But the way that the insurance industry started in 1667 is not like the way it is now. Because at that time, there was no fire service. There were no fire trucks who would come out and put out the fire. So the insurance companies themselves paid for their own fire service. Okay, so each home or house which was insured was identified as such, and so an insurer's own fire brigades would come along and put out the fire at their insured properties. Now, this whole idea that major financial stakeholders in a disaster can contribute to risk mitigation is an idea that needs to be thought about carefully within the context of pandemic disease. Okay, because amongst the biggest stakeholders who stand to lose in the case of a major pandemic are the life insurers. And the whole crisis of last year has raised this whole question as to the degree to which some of these major stakeholders should not be just relying on governments or international organizations to come up with mitigation services, but help to promote them and fund them themselves. So fire as a hazard is like that. Of course, we have civic fire services to deal with fires. With regard to other natural hazards, one of the major sources of loss following natural hazards are secondary perils. Apart from fire, there's the risk of pollution and contamination. And these, again, are types of secondary peril, which, if they are not dealt with straight away, can lead to hugely increasing losses. And within the health context, I can just mention typhoid and cholera. One of the great tragedies in developing countries is the fact that a major disaster like a tropical cyclone can cause huge amounts of loss to homes and property and so on. Now, tropical cyclones themselves don't necessarily kill that many people. However, unless there are financial resources made available soon after to help deal with problems of water supply and so on, then you can have large numbers of people dying from these waterborne diseases like cholera and typhoid. If I can just mention Nepal right now, that following the magnitude 7.8 earthquake in Nepal in April, there's now a serious typhoid epidemic in Nepal. And there again, what is needed for a country like that is to have the medical resources to deal with this kind of outbreak as and when it arises. But of course, cholera and typhoid don't carry the same international risk as a pandemic infectious disease does. But nevertheless, within the context of what we're talking about mainly here at this workshop of pandemic disease, the key issue is that there are stakeholders out there who stand to lose huge amounts of money if there were to be a recurrence of a severe pandemic. And now is the time to engage with this community, to get them to front up with contributions to helping to mitigate this risk. And that's one of the main points I should be trying to hammer home at this workshop. Okay, thank you.
Yeah, thank you very much, Gordon. If I can follow up with another question, you know, comparing it to other disasters, what about early warning? Do you see that as different, and how can we get earlier alert about, and because when something grows exponentially, you know, time is essential, and so how do you see the systems for early warning for these different kinds of, you know, disasters?
Yeah, well, so thank you, Olga.
Sure.
Again, I think what is very interesting is to compare early warning across the range of perils. So we have early warning for various types of meteorological hazard, and we have early warning potentially for a pandemic. And this is an area, Olga, which we've discussed together, namely, it's an area where there needs to be a substantial amount more funding made available in terms of surveillance to catch the early signs of a pandemic emerging. And this, again, is one area where there really is an opportunity for a public-private partnership to develop to help fund better surveillance, especially veterinary surveillance. In fact, this is one initiative that I'm currently working on in Singapore. Singapore is one of the wealthiest countries in the world in terms of GDP per capita, but also it's a country with one of the highest population densities anywhere in the world. And it's a country where the potential loss from a pandemic economically would be absolutely catastrophic. And already there are signs of real interest in Singapore in developing a public-private partnership to help finance the kind of surveillance which would help to catch emerging pandemics far earlier than has been possible before. And Olga, you've written a very nice paper outlining some of these issues relating to surveillance and how much it would cost. And I think one of the main ideas to be discussed at this workshop is the way in which these needs for better surveillance can be met in terms of innovative ways of public-private partnership and financing. Thank you.
Thanks a lot.